Previously on our series on mental health care in Kenya.
Our children today are not doing very well on a large scale.
If mental health would have been part of the curriculum, my students are told how to cope with stress and the expectations of life.
And similarly, the Ministry of Health is in a similar process. First and foremost, they want to review the specific laws that exist to make them compliant with the Constitution, as well as developing a harmonized law, which brings together all the health-related laws.
Safari Africa, from the heart of the world.
In recent times, Coast Province has received what has sometimes been described as unparalleled media coverage, but often for the wrong reasons. Drugs. In part 1 of our series, we discovered that one of the most prevalent causes and effects of mental illness within our country, and more so in Mombasa, was due to alcohol and substance abuse. Amani Counseling and Training Center Mombasa is one of the many institutions of training and treatment that I visited in the course of conducting this investigation. I spoke to Sarah Mongombe, a counselor and the area coordinator of Amani.
My name is Sarah Mongombe. I work with Amani Counseling Center Mombasa. We counsel generally some children, especially the drug addict children. Quite a number of them have been referred from different schools to us. Some children are naughty, misbehaving in schools, and they are suspended. So they are brought to us and we counsel them.
As compared to the prevalence of stress and stress-related conditions as found within the Nairobi scenarios, and as explained by Dr. Mwiti of the Oasis Institute, Mombasa has its own unique challenges, as Sarah elaborates.
The drug addict children, their problem, I want to believe, are parents. Parents want to keep their children indoors. They don't want to expose them out. So actually they surround them, they protect them. And so we don't get many cases of counseling. Though Mombasa is almost 75% drug addict zone. Okay, there are rehabilitation centers, but here we get very few cases. Those who come, they come voluntarily. I want to stop smoking, I want to stop taking these drugs, but I don't know how. So we take them through sessions, and some of them are able to stop, those that come.
Safari Africa, from the heart of the world.
According to Sarah and Nakada, the almost lack of a structural public rehabilitation center system has proved to be a challenge on how addicts can then attempt to try and access those being offered by private institutions such as the Reach Out Rehabilitation Center, Umoja Rehab Center and Rising Sun, amongst other centers and institutions. Another issue that also seems to stand out with the Mombasa scenarios as compared to Nairobi is the apparent lack of parental care, presence and supervision of their children, a factor that has led Nakada to firmly believe that lack of parental authority has strongly contributed to the increased experimentation and use of drugs and alcohol in Mombasa. According to a survey carried out within the Coast Province in 2010, Nakada found out that peer pressure and curiosity were the two main contributing factors that lead the youth within Mombasa and the greater Coast region to begin taking drugs, a finding Sarah agrees with.
Children, young girls, most of them are from single parents. Some of them, they are left to look after their siblings, so they don't go to school. They are left to go to school. Some of them, their parents or their mothers are selling pombe. So the mother sometimes atamwacha huyu msichana mdogo aendelee kuuza na pombe. The mother will go somewhere to look for money elsewhere. Wengine, they are poor. They've not had food for 3 days. Why does a child go without food for 3 days? Where is a parent? Then if they have no money or they have no food, the mother should go up and down to look for something. So you see, that's where I was. Atuna was you are not worried whether the child is eaten or not, or this my child, I must work hard for him or her apate chakula. No, kama hakuna basi, you stay hungry.
Other institutions based in Mombasa, such as the Kenya Association of Professional Counselors and the Kenya Institute of Professional Counseling, in their questionnaire feedback, reiterate that drugs were the leading cause of mental instability amongst the Mombasa people. Information from community informants who spoke to Nakada have it that when drugs are confiscated, they are never destroyed, but usually find their way back into the community because of the underhand dealing between the local law enforcement and drug barons. This severely hinders efforts to rehabilitate and counsel recovering addicts. In the next part of our series, we will focus on the reform process of the mental health care sector. What is currently going on within the government and between the government and various stakeholders? What is the law going to look like? And how will it improve not only the lives of those affected by mental illness, but about those who are tasked with taking care of them, meaning the lecturers, the psychologists, the doctors, and the nurses. Keep it Safari Africa.
Safari Africa, from the heart of the world.